So the lumbar plexus is one of the again important plexus in the lumbar region that usually forms as a uniting by the anterior rami of L1, L2, L3, L4 and L5. So usually L1 to L5, the ventral rami of these spinal segments, especially anterior rami, they unite, forms as a network arrangement, plexus and give the branches. So it is no any further complications, just simple. The anterior rami of L1 to L5, they segments unite to form such a different branches. Here in the important branches, that is again these anterior rami unites and divisions as the form of posterior division and anterior division. So these rami are unites and makes the divisions of anterior and posterior divisions. You can see the blue color is anterior division, then the yellowish white is posterior divisions. So here important branches is most of that femoral nerve, that is from the posterior divisions, and also lateral femoral cutaneous nerve, then iliohypogastric nerve, ilioinguinal nerve. From the anterior division, the important obturator nerve and also genitofemoral nerve. So among that, the most of the important femoral nerve that mainly supplies to the anterior part of the thigh leg region, and among that in the obturator nerve, it is also one of the important nerve which will be supplies to the medial compartment, supplies to the group of obturator muscles, and similarly in the lateral aspect, the lateral femoral cutaneous nerve from the posterior division that supplies to the skin of the lateral part of the femoral region, then also ilioinguinal nerve and iliohypogastric nerve. See this description of the lumbar plexus. It is formed by the ventral rami of the L1 to L5. That L5 is specific, but most of that portion is up to L4, but L5 unites with the L4 and forms as an important lumbosacral trunk. That is point you have to be remember. So usually in this lumbar plexus L1 to L4, but L5 is also joins and it mainly helps for the formation of lumbosacral trunk. Then it lies in the posterior part of the psoas major muscle in the pelvic region. The branches emerge from the lateral and medial borders of the muscles. The important branches, as I told, the iliohypogastric, ilioinguinal, that ilioinguinal enter the lateral and anterior abdominal wall, then lateral cutaneous nerve of the thigh that enters the thigh region in the lateral aspect. The femoral nerve is an important nerve formed by L2, L3, L4, enters the thigh behind the inguinal ligament. Mainly it related to the vessels, that is vein, artery, nerve laterally, that is femoral vein, femoral artery and femoral nerve. Then again the another important obturator nerve, that is also by L2, L3, L4, that crosses the pelvic brim in front of the sacroiliac joint and behind the common iliac vessels, that mainly supplies to the group of muscles. And among that you have to be remember, these are the important branch which will be from the lumbar plexus. The next another important is sacral plexus. Generally we may call it clinically as lumbosacral plexus, because the sacral plexus is usually the uniting by the L4 and L5, that is lumbosacral trunk. That lumbosacral trunk, that is union by the L4 and L5. Then again along with that S1, S2, S3. So L4, L5, S1, S2, S3, they ventral rami, they unite to form as a sacral plexus. So in this sacral plexus again, these ventral rami are unites, forms network and divides as the anterior division and posterior division. So be remember, the ventral rami unites becomes as a network that divides into anterior and posterior division. So the main important nerve in this sacral plexus, that is sciatic nerve. So this sciatic nerve union by or joined by the both anterior and posterior divisions. So these mainly the portion of sciatic nerve, that important nerve in related to the posterior compartment of the lower limb. So these the portion L4, L5, S1, S2, S3. So union of this important portion. Sometimes S4 also joins. S4 means sacral. So main L4, L5 and S1, S2, S3, S4 spinal segment nerves. The L4 nerve is joined with the L5. That is important. Be remember here. That is lumbosacral trunk. The L4, L5 unite and forms as a lumbosacral trunk. So the trunk descends, coming down over the ala of the sacrum, then crosses the pelvic brim in front of the sacroiliac joint and joins with the nerve S1. So this lumbosacral trunk that descends just over the ala of the sacrum, then crosses the pelvic brim in front of the sacroiliac joint and joins with the nerve of S1 nerves. So usually the important branches, as I told, both dorsal and ventral divisions are usually the both divisions, ventral and dorsal divisions, gives the branches. The first important is sciatic nerve. So this sciatic nerve has two components. That means that the two major important nerves. One is common peroneal nerve and another one is tibial nerve. So usually the common peroneal nerve is forms the dorsal division of the L4, L5, S1, 2. The common peroneal nerve, that is the formed by the dorsal division of plexus, that is usually segment is L4 and L5 and S1 and S2, and the tibial component, the tibial nerve, that is from the ventral division of L4, L5 and S1, S2, S3. So this is the two important nerve. We remember the common peroneal and tibial nerve. Both are take a division in the popliteal fossa region. The sciatic nerve is coming out from the pelvic region to the thigh region through sciatic foramina. That you already know that sciatic foramina is a foramina related to the posterior border of sciatic notch by an arrangement of ligaments. So this nerve is coming down in the posterior aspect of the thigh, medial aspect, and then it will be enters the popliteal fossa just at the upper border of the popliteal fossa, that is divides into two divisions. One is become the tibial component, the tibial nerve, then another one is common peroneal division, common peroneal nerve. So these most are important to supplying the posterior compartment of the thigh and leg and foot region. So again here there is a posterior cutaneous nerve of the thigh to the skin, posterior part of the thigh, that is supplied by the posterior cutaneous nerve. So the dorsal division of S1, S2 and ventral division of S2, S3, that is the posterior cutaneous nerve of the thigh. Both divisions, that is the portions will be forms as the posterior cutaneous nerve of the thigh. So see here of this one, posterior cutaneous nerve divisions, both ventral and dorsal division. So this is sciatic nerve, that is fibular and tibial component portions. So this is about the sacral plexus. So important branches. So just again you have to make it very clear concept. Branches from the dorsal division, that is superior gluteal nerve, inferior gluteal nerve, the nerve to piriformis and perforating cutaneous nerve. So mainly the gluteal muscles, the gluteal region, that is innervated by the two important nerves, that is superior and inferior gluteal nerve, the nerve to the piriformis and perforating cutaneous nerve. So these are the gluteal region innervation nerves by the dorsal divisions. Then branches from the ventral divisions, that is particularly the nerve to the quadratus femoris, nerve to the obturator internus, then pudendal nerve, branches to the perineal muscles, perineal region, that is particularly muscular branches in the perineal region, then pelvic splanchnic nerves. So these are the branches from the ventral division. So these important branches and the distributions of the portions. So just to be concentrated with the sciatic nerve. It is the largest branch of the sacral plexus. So the sciatic nerve is largest branch of the sacral plexus and thickest nerve in the body. Don't forget it. Largest branch and also thickest nerve in the body. It begins in the pelvic region and terminates at the superior angle of popliteal fossa by dividing into tibial and common peroneal nerve. The two divisions, the two branches of the sciatic, not you can take it as branch, you can take it as a division of the sciatic nerve, that is anterior division and posterior division, the two components of the sciatic nerve. You can take it as a component, not as a branches, because starting with the spinal segments, they have a two component of after the uniting by the ventral rami of L4, L5, S1, S2, S3, that divides as a ventral and dorsal divisions. So that divisions will mix as a portion of branches. So usually this sciatic nerve is important largest branch from the sacral plexus and thickest nerve in the body, that begins in the pelvis and terminates at the superior angle of the popliteal fossa by dividing into tibial and common peroneal nerve. The tibial part is formed by the ventral division of L4, L5, S1, S2, S3. The common peroneal part is formed by the dorsal division of L4, L5, S1, S2. So we remember the ventral division and dorsal division. The ventral division is tibial component, the dorsal region is common peroneal nerve portions. So these are the two important nerves in the posterior component of the lower limb. So this point, how that nerve is courses in the pelvis, it lies in front of the piriformis muscle. First it lies in the pelvic region in front of the piriformis muscle. Then it enters the gluteal region through the greater sciatic foramina below the piriformis. Then runs downwards, passing between the ischial tuberosity and the greater trochanter. So this nerve passes between the ischial tuberosity and the greater trochanter of the femur. The ischial tuberosity is a part of the hip bone. Then it enters the back of the thigh, runs vertically downwards up to the superior angle of the popliteal fossa. There it terminates by dividing into the tibial and common peroneal branches. Then branches, others, the articular branches, then muscular branches, the terminal branches, that is tibial and common peroneal nerves. So be remember of this sciatic nerve is an important nerve that gives the branches. The articular branches means to the joint region, that is mainly to the joint of the popliteal region, the knee joint, then also to the muscles of that region, the muscular branches, and the terminal branches are tibial and common peroneal nerves. So we remember the applied anatomy of this nerve, especially most of the common complaint, the patients which will be complaining the pain. What type of pain? That is shooting pain along the branches is known as sciatica. The shooting pain along with the branches is known as the sciatica. The pain starts with in the region of gluteal region and radiates along the back of the thigh and lateral side of the leg to the dorsum of the foot, almost along with the courses of the sciatic nerve. So usually the shooting pain along with the branches, that along with the known as sciatica pain. This pain begins in the gluteal region, particularly the gluteal greater sciatic foramina region, and that radiates continuations along the back of the thigh and lateral side of the leg up to the dorsum of the foot. So the nerve may be injured by penetrating wounds or the dislocation of the hip joint or the fracture of the pelvic region, the pelvic bones part, that results in loss of all movements below the knee and also a sensory loss in the back of the thigh and the whole leg. This is a symptoms, mainly the loss of the movements of below the knee joint and also a sensory loss in the back of the thigh region and the whole leg if this sciatic nerve is injured. That may be cause of the any wounds may destruct the nerves, or it may be a dislocation at the region of the hip joint, or there may be a fracture in the pelvic region that may leads that may causes the symptoms, the sensory loss in the back of the thigh region and also the whole leg, because posterior cutaneous nerve of the thigh associated with this, and also the movement of the leg. That is the one of the applied aspect of the things. So just be remember of this explanation, that is the the lumbar plexus and the sacral plexus. I hope you are clear about this point. So don't forget the sciatic nerve, posterior